My name is Wafae Yonsi, and I am a strategist here at 83 Bar.
And what does a strategist do? What has been your day-to-day function so far?
Basically, we handle the strategy for our clients. We take care of the brief internally for us, as well as to present to the client. Also we kind of come up with our, communications flow as to which is, basically our strategy for how things will go from A to Z, from basically getting a lead and managing those campaigns to get people to provide us with their information and see if those people qualify, and those who qualify and those who don't qualify would go through a flow where we would direct them to certain outcomes. So as a strategist, I handle the, part, which is the acquisition part in acquiring those leads, and also handling, strategizing basically where, what would be the outcome for their journey, basically with us, from acquisition to whether we're going to be connecting them with a site, or whether that would be, thank you for your participation. Unfortunately, you do not qualify for this, but here are some other resourceful information that you might benefit from. We basically make sure that we have all that in place, and we present it to the team internally, and then we present it to the client. We answer all those questions and make adjustments, and then make sure that we have everything that the client would need in terms of creatives. So we work with the creative team in terms of what we want them to produce. We review that, we get that to the client for their approval, and of course we work very closely with the project managers, which also handle they basically handle the communication with the client. They're always present with the communication with the client. However, if there are any questions with regards to strategy, or if anything that involves strategy, we're there as well. We work as a team, of course, and we help each other out along the way. I hope I didn't leave. I left a lot of parts out, actually.
It's all good. Well, when you think about your role in the strategy, and clearly the goal is to recruit patients, but there's so much more than that the 83 Bar platform can provide. How do you characterize, or how do you think about it for the client's benefit, that you say, we're going to do patient recruitment plus? What is the plus in your mind that you're adding?
Well, because again, here at 83 Bar, we don't just manage the, we do the recruitment, and the way we do the recruitment is important, and it's not like how other agencies per se would do their recruitments. And we do manage the patient's journey from A to Z, from symptom to solution. And for the recruitment, yes, we put our ads out there depending on where we would find the population that would be interested in the solution. And in that process, also, we need to, have our surveys, our quizzes in place to get them to see if this is something that would be a good fit for them or not. We do that. We have our patient activation platform, which basically we locate, we educate, and we navigate the patients across, whether it's pharma, advice, or diagnostic campaigns, and whether our client is in clinical trials phase, or if it's a commercial client. So we find them. That's how we locate them, and then we see whether they qualify, they're a fit, and then we educate them about, what it is that we're talking about, and then like move them along the way based on whether it's something that's still interesting to them or not, and depends on which outcome they would be at.
Yeah, fantastic. Well, and you obviously have a lot of other experience before joining with, advertising and promotion and other technology startups and so forth. When you compare and contrast, what is it about this 83 bar system that is different than just running social media ads? It's a little bit more than that. What is your viewpoint so far?
Absolutely. So here at 83 Bar, the focus is on conversions. The focus, and when I say conversions, I say I mean actions, and not just, spreading awareness about something or just, sending them to a website and that's it. Because again, with the digital platforms, the way you target is very important, because when you target, when you set it up in a way for people to go to a website, just generate traffic per se, then what the algorithm of those platforms, what they're going to do is they're going to send it to people who are more likely to, click on something just to get clicks. But it doesn't mean that they're going to actually take any action once they're on the site. So that's the difference, is that we focus on people who are going to take action, people who are going to, go ahead and fill out our surveys, take the quiz, and also to the right people, those who fit this description, and not to anybody, and that's it. And they're going to, it's gonna not gonna be something that they're gonna be interested in, or it's not gonna be a good fit. So everything we do is to drive action, and all our campaign optimizations and decisions are based on real data, which makes our strategies effective and successful. Other, of course, important differentiators would be, transparency, timeliness, accessibility, and organization.
Very good. And you mentioned timeliness. I've heard this often mentioned, that speed is so important to what the 83 Bar team is doing, from the beginning of the campaign right through the speed to having the nurse call the patients back and things like that. Why is that so meaningful from the patient's point of view? What has speed got to do with it?
Yeah, of course. Well, first of all, a lot of patients are not aware of all the treatment options that are available to them. And our process not only helps them learn more about the treatment, it also helps them get it faster, which is extremely important, especially for patients that are suffering and desperate for a better solution. So basically putting them on a pathway where they can get everything they need along the way is very meaningful to them, and it's very important to them. It would be to anybody.
Sure. And so turning the page internally and personally, you recently joined 83 Bar. What attracted you to the company?
Well, to be honest with you, when I looked at the job description and when I looked at the company and the company values, I really thought that it would be a great fit. First, the job itself is basically everything that I was looking for. And one thing that was extremely and is extremely important to me is also integrity. And that's, because I've been with companies that, I wouldn't say were the best at that. And that was something that, was important to me. And I am happy to say that I found that here at 83 Bar. And not just because of course the job description was a fit, the company values was a fit, but then working with the people and also seeing that part of integrity, to me, is basically everything.
Super. And if you were speaking, let's say a candidate who was thinking about a job at 83 Bar, as we continue to grow and build out our teams, what would you say to somebody who's looking at 83 Bar?
I would say, that 83 Bar is an excellent work environment. It's working with amazing people, and the people make the company. And I think it's a company that cares a lot about its clients, that cares a lot about the patients, and if they have that in them, if they can dedicate themselves, if they are looking for a place that is doing basically a lot of good in the world, because it's not just a job, it's basically, you are actually contributing to something amazing, then go ahead and apply.
Fantastic. Well, let's circle back to the very beginning then and sort of put a punctuation on our conversation. And when we think about serving the patients, yes, we're recruiting, we're promoting, but what are we doing for the patients that goes beyond simply recruiting them to a trial or to a medical treatment?
Well, I'm sorry, could you repeat that once?
Well, when I think about it, but that's okay. It's all good. It's all good.
It just cut a little bit, that's why.
I said a lot. So yes, we're recruiting, but we want to think about it as serving, the patients. Okay, that we're actually trying to promote, yes, awareness, but help them find better treatments. How would you say that beyond patient recruitment, what are we doing for the patient?
Beyond patient recruitment, one important factor that we're doing for the patients is the educational part of it. Because when we recruit the patients, they have a lot of questions, and it's so interesting, and sometimes even like misinformation about certain things. So I feel like that education part is very crucial for the patients, so that they gather more information and it gives them time. And we also after that is the options that would be available to them, whether they want to follow through with that treatment with the same doctor, or with get a second opinion, or we give them also these other options, and we are with them along the way. We never kind of drop them off, but we're there with them along their journey, and we make sure even at the end to check on them to see, okay, how was the appointment? Did you get an appointment? You didn't. We don't abandon them. So that says a lot, and that says that we really truly care about them, and we would stay with them until basically to the end.
That's good. And then to clients, what would you say that the system, the technology, the platform is doing for them as a sponsor of a trial or as a manufacturer of a new treatment? What are we doing for the clients that's above and beyond just recruiting patients?
Yeah, absolutely. Because we're basically doing everything else almost. We're recruiting, and they don't have to, have to worry about, do I need to set up a call center, recruit nurses, do this, who's going to take care of so many hassles that they would have to deal with, that we, take care of in a way that, we've done this efficiently for so long, and I feel like it's the way we are handling the process is basically the most efficient process I've ever seen. And I doubt if they were to do it themselves, it's going to take them a long time to even come close to the level that we're at right now. So from the call center and having, trained nurses who would, talk to their patients and educate them, from the, coming up with the research, with the questionnaire, which is previous to, the call center, from, directing them to the sites and site management services, and I can go on and on and on. It's basically doing almost everything else for them, and it's not just the recruitment.